Good afternoon to your cherished viewers and listeners. I'm Dr. Mrs. Anastasia, the Director for Traditional and Alternative Medicine of Ministry of Health. I'm here this afternoon by the kind courtesy of our Honorable Minister, Honorable Kwabena Minta Akando, MP for Draboso, Western North. And so today's occasion is that the Traditional Herbalist Association of Ghana, they are celebrating 28 years and also adoring their new name. And so the Honorable Minister delegated me to represent him. Talking about progress made with traditional medicine development, I can say that traditional medicine is as old as human civilization. Even before our forebears, before the creation, God knew that we needed health. That is quality health. So God in his own infinite wisdom gave us herbs, seed, flowers, roots, stem back of all the medicinal plants for our well-being and for vitality. And so since 1961, the first president, Osajifo Dr. Kwame Nkrumah, put together the Ghana Psychic Healers Association and then gave them the standard, the ethics of practice. And ever since, all the successive governments have contributed one way or the other to the development of traditional medicine in our nation. The first thing that was done was to establish Center for Plant Medicine in 1975. The mandate of Center for Plant Medicine Research is to research and develop herbal medicine. And so every medicine or herbal medicines that are produced go through rigorous regulations and standards. So first, it goes to Center for Plant Medicine or any of the research institutions to authenticate the safety and the quality of the medicines as well as the efficacy of the medicines, and before it goes to Food and Drugs Authority. So since 1992, Food and Drugs Authority was also established to make sure that it gives market authorization to safe, quality, efficacious herbal medicines for consumption by the populace. And so the Traditional Medicine Directorate since 1991 was established to formulate policies, to monitor these policies and evaluate them to bring them in accordance with public health policies. So since 1991, the directorate has been established. And also we have Ghana Federation of Traditional Medicine Federation, that is called GAFTRAM, made up of Ghana Federation of Traditional Medicine Associations. And so all these associations come under this big umbrella of federation that communicates between their members and the government for all their needs. And so since 1999, this association was formed. And then going on and on, the government saw the need to regulate the practice and the practitioners as well. So when it comes to traditional herbal medicines, we have three P's. Three P's, very important, three P's. So we have the products, that's one P. We have the practitioners, those who manufacture the herbal medicines, the products, whether for procurement or for selling or for whatever purposes, or even to the patients at the hospitals. We have the practitioners who champion these activities. And then we have the practice, so the three P's. So the first P, which is the products or the herbal medicines, are being regulated by Food and Drugs Authority. And then the practice and the practitioners are regulated by the Traditional Medicine Practice Council under the Act of Parliament, Act 575 of 2000. And so we work with various stakeholders, the universities, our other manufacturers, even some of the pharmaceutical companies. We work with them as well as the policymakers. And so we have been working and then we have made a lot of progress. One thing that I want to assure Ghanaians is that now we have the integration policy. Ghana has been able to integrate herbal medicine and orthodox medicine together. So about 55 of our healthcare centers, hospitals, district hospitals have integrated herbal medicines. So you can go to any of these hospitals and you can have your healthcare choice. If you want to be attended to by herbal medicine, you will be attended to. If you want to do the orthodox, you will be attended to. And these herbal medicine centers are being superintended tended by, we call them medical herbalists. This is a degree course run by the Kwame Nkrumah University of Science and Technology. And so the Department of Herbal Medicine, and they have this degree in BSc Herbal Medicine. And so since 2000, government established this degree course at KNUST, and the products we have over 500 of them. They are superintending all these herbal medicine centers, including some private clinics as well. And so they are adding quality, they are bringing on board safety, and they are making sure that there's quality healthcare. We all know that the government of Ghana, together with the whole world, we have the SDGs, you know. So these SDGs, by the year 2030, SDG, that's Sustainable Development Goals, especially with the health, we have the goal 3.8. It means that everybody, we want to achieve health by all, by everybody at all ages, and none should be left behind. So, talking about health, we know the importance of herbal medicine. We know the practitioners, the role they play in our primary health care. Formerly, anybody who lived in the village, who lived in any community, the first point of call was to go to any of the clinics for the indigenous practitioners. That is where they seek their primary health care before they plan to visit the orthodox medicines. So the Alma Mater Declaration cited the practitioners as part of the healthcare delivery system. And so we brought them on board. That is how come we regulate them and we make sure that whatever they produce for human consumption, whether it's the services that they are providing or not, is of the best of quality, and making sure that it is safe, and also whatever they are doing is efficacious. You and I, we know that it is very potent. Herbal medicines are very efficacious. Otherwise, we wouldn't even talk about them. Every community, every nation has its own recipe for the treatment and management of both communicable and non-communicable diseases. And therefore, we cannot underrate the importance and the contribution of traditional medicine in our healthcare system. As much as we know that it is so helpful, we are also not ignorant that if it is not properly regulated, if they don't standardize the products well, it will also have its onward consequences, or we call it adverse side effects. People tend to say that, oh, every medicine is safe. Even though it is natural, it is safe. But unstandardized ones could be very harmful to our system. And therefore, we train them as part of the things that we have done over the years. We have had technology transfer because, yes, they don't have the formal education. Their education has been just the transfer, orally transfer from generation to generation, from families to families, and that is how come they learn their trade. And therefore, they may not know it all. So over the years, we have really built capacity. We have trained them, we have brought the technology we have learnt. I am a champion of that. And so we train them at any instance, any time that we get opportunity. And therefore, you can go around and see that these days there's much improvement in the product formulation as well as their packaging. Unlike before, where they used to package their medicines in gallons, in big bottles, no labeling. But these days, due to technology transfer, they are able to produce quality medicines, safe medicines, and even the packaging and then the labeling. So I think Ghana has made strides in developing traditional medicine. Aside the integration, there is research. We have the Center for Plant Medicine that has the mandate to research and develop traditional medicine. So most of the products we see have gone through rigorous research before it gets to Food and Drugs Authority for market authorization. The government has made strides also putting together recommended herbal medicines list. This list is supposed to guide the practitioners in their rational prescribing. And so over the years, I think the first edition was in 2008, and then the second edition was in 2017. So now, one of our main challenges is to include this list onto the National Health Insurance Medicines list. So if you ever want to make sure that healthcare delivery is holistic, in other words, we are talking about universal health coverage, achieving health for all without any financial repercussions by the year 2030. Then we are suggesting that we should bring on board herbal medicines as well, because almost everybody in Ghana contributes towards the National Health Insurance Scheme, so that those who go to the hospitals, whether private or public, and who want to have the herbal or traditional medicine option shouldn't be denied. And so I think the Minister for Health, the previous administration, did a lot of work, but we couldn't enlist it onto the main National Health Insurance list. And I know and I believe that with the new administration, with His Excellency John Dramani Mahama, through the Minister for Health, Honorable Kabuna Kando, they will just make sure that they expedite action. And then sooner you will hear that this thing has been enlisted so that you will have holistic health care. Thank you so much.